Welcome to LAPAC's initiative on cervical cancer in collaboration with M-Pharma. Last year, LAPAC organized the first meeting or CPD on cervical cancer in collaboration with the Oncology Pharmacists Association of Ghana, and this year it's in collaboration with M-Pharma. We all know 4th February marked the World Cancer Day, and January was the Health Awareness Month on cervical cancer. So we go on to still learn about cervical cancer so that we can carry out our duties as pharmacists. Cervical cancer is the fourth most common cancer in women worldwide, but the second cancer in women in Ghana, and the leading cancer after breast cancer. It's also the most common gynecological cancer in Ghana, and more than 80% of women present with liver diseases. And as I said, we're going to learn about cervical cancer today. And it's very interesting that LAPAC again is collaborating with M-Pharma. And I promise you this is going to be an interesting evening. So tighten your seatbelts, get glued to your devices. And we are going to learn about cervical cancer again, comprehensive understanding of cervical cancer, the causes and how to prevent cervical cancer through early detection and screening. Without wasting much time, I want to invite Madam Sofa Abba, who is the CEO of M-Pharma, to give us the opening remarks. Madam Sofa Abba.
Thank you, Madam Chair. I'd like to welcome everybody to the call. I also have in the room with me Emmanuel Ajay, who is our Vice President for our diagnostics and wholesale business, and Mr. Akram, who's in charge of our global product marketing. So before we start, we want to thank you for giving us this opportunity to join this call. Just a little brief about M-Pharma. M-Pharma is just not in Ghana. We're a healthcare company in 9 African countries, including Ghana, Nigeria, Kenya, Zambia, Uganda, Rwanda. We have 2 businesses, right? We have our B2C business, our B2B business. Our B2C business is our retail business, in which we have 564 retail pharmacies. And in these pharmacies is where we really support the pharmacies in providing primary healthcare services to patients or the communities in which these pharmacies are in. So for example, in our 564, we have some pharmacies, 136 pharmacies that have routine doctor services. So we offer telemedicine in our pharmacies, where we have nurses placed in those pharmacies to support. And we for this week, for example, the month of February, we've served about 3,000 or so visits, routine visits to our pharmacies. So that's a little bit about M-Pharma. But I think the reason why we were invited to do this call is last year, 2022, and the tail end of 2021, we launched this 10,000 Women campaign, where we decided that we want to test 10,000 women in Ghana and Nigeria for HPV. The purpose of that was to really create awareness and really have M-Pharma be the thought leader around cervical cancer. So we ended the project in Ghana last December. And by the end, we have tested 5,600 women, which is the biggest testing that's ever been done in Ghana. And we owe a great thank you to Dr. Ifa and his team at Bator, who really supported in making this happen. He has about 200 plus nurses across the 16 regions who were helping with identifying the women, first of all, and then also taking samples. One of the things that came out of this exercise is that we also had a group of corporate women who we were using the Evelyn brush, because I think one of the things we've realized is that one of the barriers to this HPV and testing is the intrusiveness of the testing. So if we could offer women the opportunity to actually do the sampling at home and then take their, their brushes to labs to get it tested, could we encourage or could we increase testing? And what we have found is that there's been a strong appetite, interest in this way of doing it. And we've seen great success with the Evelyn brushes. And so I think going forward, we continue to test in Nigeria. We've tested 1,000 women, and we're hoping to test an additional 5,000, working with Mary Stopes and a few other organizations in Nigeria. So that's a little bit of why we're on this call, and we want to continue this journey of creating awareness and really improving testing. One of the things we're also doing is that we're engaging closely with MSD to also add this the whole value chain, right? So from testing, treating, and also vaccination. And so we're working closely with Merck to see what we can do around the pricing for the Gardasil vaccine, to also put that as part of the training or the program that we want to put together for cervical cancer. So we want to thank you for this opportunity, and I think my colleague, Dr. Ya, will give you more detail. We want to thank you for this opportunity. We also look forward to seeing how we can engage with you more. For those who are not already on our QRX multi-pharmacy platform, how we can engage with you more and support you in spreading the news around and awareness around cervical cancer. So thank you, and I'm looking forward to a very healthy and fruitful discussion. Thank you, Madam Chair.
Thank you so very much, Madam Sophia Ba. We are very happy to be collaborating with you today. Now, the theme for today's program is the role of the pharmacist in beating cervical cancer. Very interesting topic. How are we going to beat cervical cancer? And our speaker for today to take us through the presentation is Dr. Ya Owusu Ajiman. Now, Dr. Ya Owusu Ajiman is a doctor by profession and a doctor who graduated from the University of Ghana School of Medicine and Dentistry. She's worked at the University Hospital, Legon 37 Military Hospital, E&E Medical Center, Kolebu Teaching Hospital, and is currently the Health Services Manager at M-Pharma Ghana. She provides strategic leadership and management to disease management and preventive health programs covering HPV and cervical cancer, telemedicine, malaria, and diabetes. She works closely with community pharmacy teams to identify and document challenges and design programs that are best suited for each community. She's directly responsible for data management, team organization, stakeholder engagement, completing deliverables, reporting, and budgeting. And we are very privileged to have Dr. Ya Owusu Ajiman speak to us on our theme. Dr. Ya Owusu Ajiman, you're welcome to today's program. Please take on over.
Thank you very much, Dr. Nkansa. I will just share my screen now. I hope everyone can hear me clearly.
Yes, I can. I hope the rest can.
All right, great. Thank you so much. Okay, so for today's discussion, we'll just briefly talk about the cervix and then cervical cancer. We'll touch on HPV as well, and then we'll zoom right into the role that pharmacists can play when it comes to beating cervical cancer in Ghana. That's our context for today. So I'll start this presentation by just reminding all of us where your cervix is. Your cervix is simply described as the mouth to your womb. That's your uterus, where your baby would lie if you were pregnant. So your cervix is generally what expands and opens up for your baby to come out of your womb when it's time to deliver. So generally, besides doing that, your cervix also keeps bacteria out of your uterus, and it produces the discharge that cleans your vagina. I know we've all heard that the vagina is a self-cleansing organ, and so we shouldn't be putting things through it. So that's what the cervix does. And also changes the state of the mucus throughout your cycle. So all the women here will attest to the fact that sometimes you have it watery, sometimes it's thicker, and it changes as you go through your cycle monthly. It also changes positions to help protect your pregnancy. And those of us who have been pregnant before, you would know that sometimes the doctors say your cervix is posterior or sometimes anterior. It all does that. It does that to protect the pregnancy. So generally, for all cancers, we all have healthy cells that do particular things in the body. They all have DNA, and the DNA tells them exactly what to do. But once there begins to we need to see changes in the DNA that we call mutations, that's when cancer develops. So the same thing for cervical cancer. As long as there's changes in the cells in the cervix, then we call it cervical cancer. So when we talk about disease burden globally, WHO still says it's the fourth most common cancer among women globally. And as of 2020, these were the estimated numbers. So about half of the people that would get it would pass on, unfortunately. And 90% of the new cases and deaths in 2020 occurred in lower and middle income countries, of which Ghana is a part. When we look at Ghana, it's the second most frequent cancer in women. And in women between the ages of 15 and 44, it's still the most frequent cancer for us. Our estimates in 2021 show that about over 2,500 women will be diagnosed, and over 1,500 of them would unfortunately pass on. Now, when we talk about cancers, we really like to talk about risk factors and not causes exactly, because I'm sure we're all aware that cancers, we can't really pinpoint a cause besides the mutation happening, but we can pinpoint risk factors that would cause the mutations to occur in those particular cells. So when it comes to cervical cancer, your number one risk factor is persistent infection with certain types of the human papillomavirus, which we call HPV. We'll talk more about HPV as we go along. And we know that multiple sexual partners and then early sexual activity, studies have shown that as early as 15, 16 years increases your risk of getting cervical cancer. Then having other sexually transmitted infections, including HIV, also increases your risk of getting cervical cancer. And just like all other cancers, immunocompromised states, if you have another cancer, if you have HIV, if you're malnourished for one reason or the other, any immunocompromised states would also increase your risk of getting cervical cancer. And then we have smoking, which smoking is linked to almost every cancer under the sun currently. And then for cervical cancer and things like breast cancer, lack of access to routine screening is something that we've noticed that increases your risk of getting it. Because like most illnesses, the earlier it is detected, the earlier it is picked up and it's treated, and then you're fine. So let's talk about the human papillomavirus. So generally, it's a sexually transmitted virus, which means that any form of sex can transmit the virus from one person to the other. It doesn't matter what gender it is, it can still be transmitted. There are over 100 subtypes of HPV. We know that HPV is linked to other cancers like penile cancer, oropharyngeal, anal, vulva, and then we know it causes genital warts as well. We know that in men and women, the peak time is soon after you become sexually active, which is why we like to talk about HPV when it comes to preventing cancers, especially like cervical cancer. For cervical cancer, we've noted worldwide that type 16 and 18 cause the majority of the disease. Although certain studies are now coming up that are picking up other types of other subtypes of HPV that are causing cervical cancer, still these two cause the majority of cervical cancers worldwide. Now let's talk about can the HPV virus infections be treated? So when we look at something like COVID causing an infection, when COVID caused an infection, we weren't exactly treating the infection. We were managing the symptoms that you come with. So somebody comes with a cough or difficulty in breathing or some chest pain, or they migrate into a pneumonia. We would treat those particular conditions. But for the virus itself, we were not treating the virus. So the same thing happens with HPV. Now, if you're a healthy person, immune system all working properly, your body would clear the HPV infection. Studies show that sometimes within 2 to 3 weeks, somebody can clear the HPV infection. But we don't routinely treat HPV infection for people that it's not cleared in. So we would have to treat what comes up as a result of the HPV infection. So for example, if somebody gets genital warts, it's most likely is coming from HPV infection. We can do things like applying podophyllin. I'm sure you are more familiar with these medications. Medically, we can do surgical excision, we can do lasers or cryotherapy. And then if you come with precancerous cervical lesions, we can do what we call a LEEP procedure. With a LEEP procedure, it's like a wire that is heated, and we can use it to excise those precancerous cervical lesions so that they don't progress into full-blown cervical cancer. So these are things we can do when somebody presents with early signs of HPV infection. So let's talk about symptoms of cervical cancer. The most common symptom that most people would come with would be abnormal vaginal bleeding. We describe abnormal vaginal bleeding, what we call AUB, as any bleeding that is outside of your normal menstrual period. So if, for example, your normal menstrual period happens for 5 days, maybe started from 1st to 5th February, if you start bleeding on 9th February, 10th February, it's abnormal vaginal bleeding or abnormal uterine bleeding. If you're bleeding after sexual intercourse, it's abnormal. For women that have gone through menopause, if you're seeing any form of bleeding from your vagina after menopause, it's abnormal vaginal bleeding. Then we talk about vaginal discomfort. Most people would say, okay, what about pain? We've noticed that it's more of a discomfort, more of the females complaining they are feeling something like a mass, in the vaginal area instead of pain, instead of frank pain. And then vaginal discharge that is foul smelling, or let me say vaginal discharge that seems to have deviated drastically from what is normal for you, which is why it's really, really important that as women, as you go through your cycle, you're seeing the different ways in which your vaginal discharge can appear at different times. So once there's a change, you can quickly report it, get it checked out. It doesn't 100% mean that it's cervical cancer, but it's one of the symptoms that a lot of women present with. And then there's dysuria, which we call, which is pain whilst you're urinating. So I'll just go through this briefly. When we're staging cancers, we know that we go through, it depends on the extent that it spreads, but I won't go bore you too much with this. I just wanted to show you this to see how cervical cancer can spread through your body. So when it's stage 1, it's within the confines of your cervix. So when you really looked at the anatomy, you saw that the cervix is pretty much like a simple donut-shaped organ that is there. So once it's confined within the cervix, then it's stage 1. But as it starts to spread out towards your vagina, towards your pelvic wall, it goes down to the lower third of your vagina, we're getting into stage 3. Then once it begins to go involve your bladder, your rectum, and then metastasize is what we call spreads throughout your entire body, can go to your lymph nodes and everything else. And then we're in stage 4, and that's the stage where it's pretty difficult to do much, and we usually do just palliative care, because once it's gone to your rectum and your bladder, it means we're going to start seeing other symptoms like incontinence and things like that, which is very, very difficult to treat. So let's talk about what we can do for treatment. So just like other cancers, we can do combination of surgery, chemotherapy, or radiation therapy. It all depends on how early somebody presents with cervical cancer. So depending on the stage and your general well-being, if you have any other comorbidities, if you have some immunocompromised states or something, that all determines what treatment is offered to you. So with chemotherapy, we can use the cisplatin and paclitaxel and all of that. We can do targeted drug therapy. Right now, I know that Avastin is one of the major drugs that is used for targeted drug therapy. For immunotherapy, there's Keytruda that can be used to target the actual cells or the protein so that we slow the tumor growth as well. So that's for treatment. So let's come to preventing cervical cancer, which is actually what we want to focus on currently. So WHO launched in November 2020, they launched a global strategy to accelerate the elimination of cervical cancer. This is a global strategy that all countries are supposed to adopt. And our target is to be able to achieve all these by 2030. So we're supposed to vaccinate 90% of our eligible girls and boys against HPV. Now, why are we doing this? We're doing this because we've noticed that sexual intercourse of any form spreads the HPV infection between genders, so among genders, whichever number of type of genders people want to acknowledge. And so we can't just speak to women just because we're thinking of cervical cancer, but we also have to look at the males as well. Once we've vaccinated them against HPV, there is some form of protection, from getting HPV and spreading it amongst themselves. Then we have to screen 70% of eligible women at least twice in their lifetimes. Studies that have been done, especially in Ghana, show that a wide number of people have never been screened at all. And so this target is very, very huge. It's a very huge thing for us to achieve as a country. And we can only do that if we're all cooperating together as the different cadres of health workers and working with other companies, including local and global companies as well. And then effectively treat 90% of those with a positive screening test or a cervical lesion, including palliative care when needed. Which means that if somebody comes with a positive HPV test, what do we do to follow up to make sure that we treat them if they have anything else? If somebody comes with a cervical lesion that is precancerous, what can we do? So that's when I described the LEAP procedure, which is one thing that can be done, including when they come with full-blown cancers and even palliative care. All that is in the strategy that WHO has outlined for us all to adopt. So if we look again at primary, secondary, and tertiary prevention, primary prevention starts from age 9 because the vaccines that have been approved for use can be given to children from age 9. Then we need to look at things like health education, because once we start to educate them when they're quite younger, instead of waiting when you're already grown and you're already exposed to all these risk factors, including things like sexual activity, it's a bit too late, but we need to start early. Then when it comes to secondary prevention, for women in the general population, we're looking at things as early or even 30 years, even quite late sometimes, but for people who have HIV from 25 years, and we need to do tests, we need to do the HPV tests for them, we need to do pap smears and treat them as required. And tertiary has to do with when they've already gotten the disease, what can we do at that point? Okay, so if we look at primary prevention, currently there are 3 vaccines that are available and have been approved by the WHO for use. There's Gardasil, there's Cervarix, and there's Gardasil 9. Now, just to note that once you're vaccinated, it doesn't mean that you are exempted from any screening procedures. You would still have to undergo screening, even though you are protected to a point with the vaccine. You would still have to undergo screening procedures as and when it's recommended for you. And once you have the vaccine, so for example, let's say you're in your 30s and you get the vaccine today, it doesn't treat existing HPV infections that you may already have. It can protect you from getting new infections from the HPV virus. Okay, so let's look at the vaccines that have been approved for use. So Cervarix targets HPV type 16 and 18. We give it intramuscularly in the muscle, not recommended for pregnant women. And the majority of the side effects have to do with the injection site, which is common for most vaccines. Now, there are 2 dose schedules for Cervarix. There's a 2-dose and a 3-dose. And so either of them has seemed to be efficacious. So it's mostly a matter of cost when it comes to vaccination. So Cervarix is the one that is widely used in Ghana in most of our public hospitals, even though it has a limited range of HPV that it protects you against. If that is the vaccine that you can get, great, go ahead and get that vaccine. Then we have Gardasil, which sometimes is called Gardasil 4 because it protects against HPV type 6, 11, 16, and 18. It has a standard 3-dose schedule, although studies are coming out to reduce this schedule from 3 to 2 or 1. The efficacy of that is still being studied. But we administer this also in the deltoid or on the thigh anterolaterally. Has the same injection side effects that people see after injection. And then we have the Gardasil 9, which also has a 2-dose and a 3-dose schedule. It indicated for 9 different subtypes of the HPV, and we administer it in the same areas. Now, because I'm talking to pharmacists, I want to talk about adverse events following immunizations. So the most common ones are the local ones that, occur at the sites that thing was administered. it's fairly uncommon to have, whole systemic side adverse events from these. But for Gardasil, there has been some syncope that's followed by a seizure-like activity, which is tonic-clonic. So when we say tonic-clonic, I know we know what it means. It means that the muscle contracts and then it relaxes rapidly. So that's motion is what we call tonic-clonic. So there has been some reports of this syncope that's followed by these movements. It's usually transient, happens for a short period, and afterwards there's restoration of cerebral perfusion. So which is why after most of our vaccines, we always say people should wait 15 minutes so that we can assess whether anything is going to happen, because most of the time these things happen soon after they're given the vaccine. So we want to observe them for 15 minutes. So for Gardasil, we don't give to people that have hypersensitivity or allergic reactions to yeast, or like just any other vaccine. If you've had a prior AEF5 from it, we would not give it to you. And for Cervarix and Gardasil, we have not established safety and effectiveness in pregnant women, so it is not recommended for use in pregnant women currently. So for secondary prevention, that's where we can do the HPV DNA testing, pap smears, and then we can do VIA. So just talk briefly on these three. So for HPV DNA testing, in this case, what we're doing is we're taking a sample of cells from your cervix, and then we're going to run a molecular test on it to detect the presence of HPV DNA. So in this case, we can use a brush or a swab to swab the area, put it on, apply the reagent to it, and then we can detect whether there would be HPV DNA in that sample. And so for HPV DNA testing, it's either you get a provider to take the sample for you. So you go into a hospital or healthcare facility, take the sample, or you can do self-collected sampling, which is something that is becoming more common these days. For pap smears, which is different from HPV DNA, what we do is to take a sample of cells from your cervix also, but in this case, we would put it on a slide or in a liquid-based medium and then view it under a microscope. So what we're looking for in a pap smear is we're trying to see if there are changes in the cells. So when we observe the cells, we have certain criteria that tells us that, okay, this cell is showing signs of mutations. We look at things like the size of the nucleus and with regards to the larger cell. We look at things like stain. Is it staining with PAP? Things like that. What's the reaction to the stain? These are the things that a pathologist would look at to see, okay, I'm seeing these changes in the cell and it's in the cervix, which points to, a cervical cancer. They can even go ahead and tell us what subtype of cervical cancer, what kind of it is, but that's more advanced and used in advanced treatments. So when we do the HPV testing, right, in most low resource settings, once you get a female to come in to test, it's better you do what we call VIA, that's visual inspection with acetic acid. Once you have passed a speculum and you've taken whatever sample, whether it's for HPV DNA testing or cervical cancer, once you have the woman, what we usually do in most low resource settings is we apply 3 to 5% of acetic acid, vinegar, that's just simply vinegar, onto the cervix, and we wait a few minutes to view the changes. Now, once there are whitish changes on the cervix, we know that there are some precancerous lesions going on there. So if you look at these two images, the one on the left where the black and the red arrows are, we're seeing the white changes there. And then the one on the right, we're seeing that it has more a more widespread area of the whitish areas, as well as blood, which shows us that this is probably more advanced. Now, so this, once the acetic acid is applied to the cervix, if it changes white, it turns white, it means that we're seeing some changes. Now, the limitations with VIA is that, one, we can only do it for women that are below 50 years. Now, this is because if you look at your cervix, you can see that these changes are starting from where we call it the mouth or the slits of the cervix is and coming outwards. Now, in women that are above 50 years, the majority of them will be postmenopausal. Now, this area tends to shift into the canal. And so we're not able to get this area, which we call the transformation zone, this area moves inside the canal. So we cannot do VIA for such females because we won't see these changes as clearly as we can or as we would want to. Now, when you do the VIA, you can either use the naked eye to observe the changes, or you can use what we call a colposcope, which is a device that has light, and so it shines into the area, shines on the cervix, and then you can see the whitest changes easy. And also this device also helps us to take biopsy or excise any precancerous lesions. So when I mentioned the LEAP, for example, you can have a colposcope also to, illuminate the area, and it helps us to take a sample, see clearly, so that we're not saying, oh, we can't really tell what it is. So the colposcope helps us, although using your naked eye to view the changes with acetic acid also works and also gives good results. So if we look at recommendations for age, reducing your risk of getting cervical cancer, it's said that we say 21 to 29 years, but we all know that sexual activity starts way before. So most of the recommendations now are saying that your first pap smear test should come within a year of your first sexual activity. So if it's before 21 years, that's when we're encouraging that females start getting the pap smears done. So the pap smear, the sample is taken, we're looking at the microscope to see whether there are any changes. Then from age 30 onwards, we're going to start doing HPV testing. And then we do HPV testing. We can do it with the pap smear every 5 years, or you can do it alone every 3 years. So your pap smear is done every 3 years, but if you're doing it with HPV alongside, then we're saying do it every 5 years. So I'm sure a lot of people have gone more than 3 years without getting a pap smear done, and maybe a lot of us have never had an HPV test done, but this is the recommendation that we have. Now, for people that are older than 65 years, there's no routine screening once they've had consecutive normal pap smears or consecutive normal HPV DNA tests, because by then we know that sexual activity may be reduced. And so once they have consecutive negative tests, especially with the pap smears of 3, that means that it's going to be 6 years minimum of tests. We don't have to continue following them up. But as usual, these are just recommendations. Usually for most females, when you come in for these tests or you go in to see your doctor, it's individualized for you based on risk factors that your doctor or your nurse would pick up as they do your pre-screening consultation. Okay, so let's talk about the role of pharmacists. So before then, I just want to play a quick video, and then we can discuss, based on what we see in the video, we can discuss what role pharmacists can play. So today we're here in Old Nzulezo. We picked this area because it's also a remote area in this country. We are affording the women an opportunity to learn about HPV and cervical cancer, and also to get screened using the self-sampling kits called the Evelyn brush. So we have done the initial education and demonstration for them. A number of them have come out to be counseled again. They've had their history taking, and they have also gone in to take their own samples using the Evelyn brushes. Now, these samples will be taken back to our labs. We would have the HPV DNA test run, and then any treatment that would be required would be done for the woman as appropriate.
We chose an area in Ghana known as Nzulezo. Nzulezo is a village built on stilts, and we are undertaking the 10,000 Women Initiative, where we intend to screen 10,000 women in Ghana and in Nigeria for cervical cancer. We are going to be using the HPV PCR test to be able to determine which kind of subtypes the women have, which predisposes them to cancer.
All right. So at the beginning of the presentation, Sufayam talked about our 10,000 Women Initiative. So that's a short video from our outreach to Nzulezo, which is in the Western region. We went there to educate the females there on HPV and cervical cancer. We taught them how to do the self-sampling with the Evelyn brushes. We had about 100 women that were screened for HPV using the Evelyn brushes. About 39 of them were positive. We had about a number of them who had to have treatment done afterwards, after the testing was done. So we're using this to describe what pharmacists can do. So first thing is advocacy and lobbying. I know that a number of pharmacists work in the government, work in Ghana Health Service or Ministry of Health, and this is where we need your help and your expertise. Even those that are working with private pharmaceutical companies or working in government institutions. If all the cadres of health workers are speaking the same language, I believe that the government will have no choice than to implement this global strategy that WHO has outlined for us. I think that we're all speaking the same language, but we haven't come together as one to, join our voices and speak the same language when it comes to cervical cancer and HPV. Then counseling or health education. We know in Ghana that most people, when they get ill, their first point of call is the pharmacy. Even this is globally, which is why companies like CVS are doing primary care from their pharmacies, because most people would go to their pharmacist first. Studies have even shown that when it comes to trust that the public has for healthcare workers, the number one is pharmacists. Most people trust their pharmacists more than any other healthcare worker out there. And so since you're the first point of call, it's great that you're getting education in cervical cancer and HPV, and you can counsel clients that come in for whatever health complaints they come in. It doesn't hurt to chip in a little bit about cervical cancer and HPV. If each and every one of us does this even once a week, it's going to greatly reduce the prevalence of cervical cancer that we're seeing as a nation. And then we have patient support programs and market access programs. So we talked about some of the medications that can be used for cervical cancer, for chemotherapy, for immunotherapy, for targeted drug therapy. Most of these are extremely expensive. And I know a number of you on here work for all these large pharmaceutical companies. And so add your voice. We need to create programs that would allow people that have the cervical cancer to be able to get treatment. Sometimes even when we pick them up and they are stage 2 or stage 3 and we can do something with treatment, payment is the problem. And so then it's like, okay, we've picked you up not too early, but it's okay, we can help you. But if you can't pay, then that's where the problem comes. And even PSVs and market access programs for vaccination would really help, because the large majority of the population would not be able to afford this. I know Cervarix is quite on the lower side. I mean, if we look at us as corporate people, but it was not so affordable for everybody. I mean, 200 cedis is still quite expensive for the average Ghanaian because our minimum wage is very low. Then vaccination and adverse events reporting. When COVID started, we saw how the Western world, especially in the US and the UK, they're using their pharmacies to do vaccinations. Like I said earlier, pharmacists globally, we know that you're the ones that the public trusts. It's so much easier if people can walk into their community pharmacy and get vaccinated. We believe that the drop-off rates will be lower and uptake will even be higher if it's done in the pharmacy, because most people do not want to enter hospitals. And it's something that we need to accept, that most people would not want to go to a hospital. And then adverse event reporting, which is something that I know is already done in most pharmacies. I know that most of you have the forms that you fill in when clients come back to report adverse events, and then you take the medication back, and I know it's returned to FDA for them to follow up on that. And then referrals, when you've done your counseling or health education, knowing the appropriate avenues to refer clients to. So we need to build those relationships up based on where our facilities are located or which organizations we work with. If you're working in this area of the country, which are the facilities you can refer clients to if you pick up something? Okay, facility A can do up to this point, otherwise it needs to be B or C. And this is where things like telemedicine play a huge role, because imagine if you're working in a pharmacy in a bit of a remote area and the client has to travel all the way to Kolebu or CAF or TTH or CCTH for treatment. Sometimes it's easier when they've had a pre-screening call with that specialist for them to understand what is going to be done. Sometimes just the fact that they're going to these large hospitals is so daunting. I mean, they have to travel, and when they get there, the hospital is so big, nobody is even helping you to find your way. And last but not least, research. Most of the data that we have when it comes to HPV, self-sampling uptake, vaccinations, we picked from outside Africa. It's not that we have zero studies, but if we compare, we don't actually have enough studies. We need to be able to do studies on our own people because our DNA is definitely different. And so our reactions to these vaccines, the way we present the illnesses may even be different. We may even be seeing mutations in the HPV virus itself. I mean, with COVID, we saw today they'll say is this subtype, tomorrow is this subtype. For all we know, there's a different strain of HPV that we should be looking at, but we're not because we haven't done enough studies in our setting. Okay. So the next slide has to do with self-sampling, but I think we can pause here and pick up any questions before we go on to the self-sampling. Dr. Nkansa.
Thank you very, very much, Dr. Ya Owusu-Agyemang. Thanks so very much. We've been well educated on cervical cancer. She's taken us of the cervix, the disease burden. She walked us through risk factors, common signs and symptoms, HPV, preventing cervical cancer, and the role of the pharmacist. If you have any questions, please place them in the chat box. She would answer the questions. We've been educated on this, and we're ready to take any questions. She took us, if you're just joining us, we started earlier on around 4, and we said this is the LAPAG initiative on cervical cancers in collaboration with M-Pharma. This is the second series. Last year, we started with the Oncology Pharmacists of Association of Ghana, and this is the second running. And this is interesting, and where the theme of today's presentation is the role of the pharmacist in beating cervical cancer. And she's told us what our role is, and I don't want to go over what she said, but we have a lot to do. We have a lot to do in prevention, and I believe it's screening, and we have a lot. We have to make sure that we are involved in primary prevention, secondary, and also tertiary. If you have any questions, please either unmute and speak or place them in the chat box, and we'll take them now. Thank you. Any questions? Any questions for, yeah? Thanks, here for that great presentation. No questions? Okay, if there are no questions, then we want to move on to the cervical cancer survivor story. There's a video show, or a survivor is going to give us her story. So please, can we have that?
Good evening.
The survivor story on...
Na mkasa mini peduana sisa me oba sina me menstruate na sisa ye kura o baby a menstruate busumi bia afa me den 3 days bia me menstruate every 3 days na fa ba every day me menstruate you crot I afa mitimi nya hwe me nanti an my week it no as an me call pharmacy be a ben na me ka cham so me bleed do no ma me drew I wait me a stop for bleeding na say edu no me de mam still not bleeding neba me fa etimi me fedro na me call pharmacist na me fedro na etimi boa mani be 3 days be but still I bleeding like I say baby basa etimi to na mo hospital because hospital no doctor na share no so ka say we be a yare fufu fibroid. Nti mika say you must even say date the be one day be no so hwa de o must no hwa de o must no your test be o must afi mo chane babebre no se de bi nti o ma me referring letter pokolebu gynae me call gynae na ya admit me o gynae ene ma me doctor your mommy doctor me last test baby into me test be I'm sure baby o masina omo yi moja na eba ne bi ni bleeding na eba no yi bi e dey call lab ni ehun say enye bibia say cancer o me yam. Until no, you refer me to radiotherapy. Call radiotherapy, no. Because your mama doctor, your mama counselor, on me kasa, say yare abana, yes, yare a bit me treaty, a manager, into mammy shrew, mammy boom, when yare out of our cotton, sorry, dear, my bonfire, when yare out of the court, it be drew so, where yare abaya. The pedria bebree into na ba treatment ho ndine nyinam na me bleed ene de me to machine so for 1 month 3 weeks every day it me starting machine 3 days na me say bleeding na jai ba ne nyinam no na ye ma me moja because ye ma me moja na moja na san ba na me bleed it ni my week it me that machine so nyina na me san ji moja na me san ye chemo me that machine so nyina na me ye machine treatment na me san ye chemo no e drip bi as a drip ye de be si so na ye de si so ye be san ma we dra obefa enti da be tro chemo na ma me call pharmacist na e wo radiotherapy no mo ko ji chemo no ma me no ma sa ma me dro na ka hono e dro na ka hono eno no ma stop bleeding no enti me ye chemo 2 times am da machine so na me say me ho ato me bleeding na baby ma me ti me di ye bibia me okay ti me em treatment ni we na radiotherapy ona machine bi so hono mo hot me sa alcohol 1 month mo de me to machine so 1 month ti me fa treatment we nyine me wo say me ho ato me na yare ne ba en ha me pa mitimi nko ejuma mitimi nko ne pe mitimi nko asori mitimi nye hwe ti me wie me treatment na fe de me ho ato mitimi ye bibia mitimi didi ye bibia ko ne pe mu na nyame adom ne me doctors ene rade ene me pharmacist boa me ndru na de nyame show mo pa doctors e wo radiotherapy omo boa me pa in fact ene nurses ene pharmacist e wo ho nyina omo nyina boa me e ma me she me nkran e ma me bibia ye fine ene me pharmacist ne so boa me ma me fa me ndru na de tie na me ne mo kase die me ho ato me but the bia me call first na me call check up 1 month this year me call check up 3 months me okay this year me ejuma e bibia me hu bleeding ni biom into order for say na say hu symptoms we are infant na fie ko hospital na nyame nyame ama doctors nimdie ne pharmacist ne nimdie mo ma yendro treat say yare we edema yen me da nyankopon ase se wabo me ho ban na me da so ti ase me sanda Dr. Scott ase obo me she me nkran pa kolebu radiotherapy anti Helen nurse Ellen wabo me bebre ona na okoje me moja ehwe me anti Felicia na obekwa nyankopon shira no na me sanda me pharmacist na se pharmacist no mo bo me ma me ndro na de yɛkyerɛ ndura ɔmo na ɔmo yiyi ma me mede ɔmo nyinaa ase Nyankopɔn nhyira ɔmo bebree nea ɔmo ayɛ ama me no aso me ne na ɛyɛ me fɛ mede ɔmo ase paa sɛ ɔmo hyɛ me nkuran pharmacists hyɛ me nkuran doctors hyɛ me nkuran me nurses Nyankopɔn nhyira obi biara Kolebu radiotherapy nyame nhyira me Kolebu pharmacists mo ayɛ adeɛ paa Nyankopɔn nhyira mo nyinaa na ɔnyɛ mo kɛseɛ sɛ meda so wɔ nkwa a mekasa meda mo ase sɛ wote me nne a na sɛ wo symptoms wei bia ɛntene fie na ɛnwuo tu anammɔn na kɔ na yɛnhwɛ wo bɛtumi akɔ pharmacy ɔmbɛma wo guidelines no na wakɔ Kolebu kɔ a yɛbɛhwɛ wo fɛfɛɛfɛ ama wo so ho ayɛ fɛ ama w'ani agye wɔ abrabɔm mede obi biara ase Nyankopɔn nhyira mo daa amen. Good evening. Mate a webi me say me ne pedua na sesa.
Thank you, Felicia, and that is a cervical cancer survivor story. That's very interesting and heartwarming. You know, we all have a role to play. This is the role of the multidisciplinary team, the doctors, the pharmacists, and the nurses helping her in hospital. I believe in the community also we have a role to play when we see or our patients present with irregular vaginal bleeding, postcoital, bleeding, intermenstrual bleeding. We have a part to play by referring them, to the hospital, counseling them. We all have a part to play. And the theme for today is the role of the pharmacist in beating cervical cancer. We all have a role to play. When our patients present with vaginal discharge, either vaginal discomfort, foul-smelling vaginal discharge, dysuria, the best thing is to refer them because it could be something that has started cervical cancer. And since we are talking about early detection saves lives, I believe we have a great role to play, by referring our patients from the community and also in hospital when they present to us. Thank you very much, Felicia. That was very interesting and heartwarming. There are a few questions in the chat box and I want to take them up. Somebody is asking whether the vaccines are readily available. I think that's Lucia, and it says yes. M-Pharma has Gardasil, is a supplier for Gardasil, and I think it's worldwide that are the suppliers for Gardasil on the market. Cervarix was GlaxoSmithKline. They are no more in Ghana, but I believe they are available also because there are some that are being sold in some facilities. Another question by Lucia: can NHI effectively cover the cost of screening and treatment? And how much are the available vaccines? And do you have the answer to that question since you work with M-Pharma? How much are the vaccines?
I'll let Sophia comment on that, please.
Pardon?
Sophia can comment on the
okay,
pricing.
Sophia, please, can you comment on the prices of the Gardasil vaccines that are available? I know they are available at Worldwide Healthcare. Sophia?
Yes. So regarding the pricing for Gardasil, at the moment, we're retailing at $75. But as I mentioned earlier on, we are in discussion with MSD to see how we can bring the price down further to help. And I think Dr. Yar talked about us lobbying and encouraging the PSPs could also be a way in which we could fund the vaccination program. I know that WHO has research out lately that says that instead of 2 or 3 jabs, one is sufficient. So that would also bring down the cost of the vaccinations as well.
I also know that there are some facilities that are, vaccinating women and young ladies. So you can try UGMC and Legon, and also Kolebu Teaching Hospital is always open. That is the reproductive health center that is always, vaccinating ladies. So please, Kolebu Teaching Hospital is always available. and the University of Ghana Medical Center is also available. There are a lot of places always available, but I think we all have an individual responsibility, and that is to make sure that we can prevent cervical cancer. It's the second largest or leading cancer that affects women, apart from breast cancer, which is first. And whether we like it or not, most of our patients report very, very late. 80% of them do report late. But this is something we can prevent. So as soon as we see all these symptoms, please do not hesitate to visit your gynecologist, because it is also the commonest gynecological cancer that we have in the hospital. And this is increasing by the day. So please, women, I'm sure if I should ask how many people have had any screenings done, how many people are vaccinated, how many people have had a pap smear this year. January was the health awareness month for cervical cancer. I'm sure quite a number haven't. So please, let's take this opportunity to have our pap smears and also have our vaccinations done, and that will save us a lot. Any more questions for our speaker or speakers? Any more questions?
Yes, Dr. Nkansa, I have one more comment, please.
Okay.
I think you asked around the vaccination. One of the companies or organizations that we've partnered with is Sanford Clinic. Sanford is going to be doing in April, the latter part of April, they're going to be launching a vaccination program where they're looking at vaccinating 1,000 young boys and girls. So it would be great if we could support them in that initiative, and the vaccination will be done for free using Gardasil. So that will be another opportunity as well. So I think that maybe near the time, Dr. Yao, those who are interested can reach out, and then we can see how we can partner with Sanford to make sure that we're able to reach 1,000.
Okay, that's interesting. Thank you very much. We look forward to having that done. Okay, there's a question, and it said, can VIA be done at home? Dr. Uswajiman.
Because of the nature of VIA, you need a second party to apply the acetic acid and then to view it. And it's a bit subjective. You need to do a couple to be sure that what you're seeing is actually a reaction. So it's not something we do at home. We prefer it being done by a healthcare professional in an approved place. I know, yes, for the one we did it in the community, in Zolezo, we did it at their community center, but done at home, it's a bit subjective. I mean, is it being done by a trained person, and why in your home? These are things we need to ask ourselves.
Yeah. Any more questions, please?
So I received a question about whether men can go for the HPV vaccination, and the answer is yes. You would be protecting the females that you engage in sexual intercourse with, and you'd also be protecting yourself from getting any HPV-related illnesses like the warts or penile cancers and things like that. So yes, please do.
Great. Thank you. Inside presentation thus far. Thank you very much. Thanks, LAPAC, for this CPD. Great. Yeah, I said earlier on, World Healthcare is the provider of the vaccines. That's great, John Hammond. I got that.
Okay, let me comment on the vaccination schedule for males. So for both males and females, we want you to start getting vaccinated in childhood. So that's why we said that from age 9 they can be. And then for both genders as well, the best time to get vaccinated is before you turn 26. So for both genders, it doesn't matter what age you are, you should still get vaccinated. For the schedule, it still follows the same schedule for whether you're male or female. If it's 2-dose or 3-dose schedule, it's fine. But as Sophia mentioned earlier, and as I said earlier, studies are showing that 1 shot is also very efficacious. So as time goes on, we can look into doing 1 shot as we do more studies in this area.
Okay, so what's the duration for the vaccination schedule for testing regards to men?
So for men, for HPV testing soon after your first sexual intercourse, but I mean, I'm sure most people have never been. Sorry, correction. For men, there's no routine HPV testing. I was speaking for women, sorry. There's no routine HPV DNA testing. The WHO has not recommended routine testing for males yet. It's not yet recommended. But for the vaccination schedule, it follows the same thing that the women have. I don't have an answer to why it hasn't been recommended yet for males, but that's it. But most of the information out there is that for the disease in males, there are other risk factors that are more important than HPV. So when you look at penile cancers, there are other things that will predispose you to it besides HPV. And that may be the reason why it's not been routinely recommended that males get tested for HPV.
Any more questions? Okay. Okay, a question from Eric or by Eric. He says, please, the survivor lady spoke about a machine during her therapy. What was the machine, please? Is there any linkage between CA of the breast and CA cervix?
So because she mentioned radiotherapy, I'm sure it has to do with that. A radiotherapy machine was used on her. I'm not quite clear on her story. I can't really get the details because I mean, she's a patient. She would not know all the medical terms, but that's my best guess. A linkage between CA breast and CA cervix. I haven't really seen any studies linking them directly in terms of any risk factors or anything like that. It would be good for us to look into this as well in Ghana to see if there's any link in our setting.
Well, it's possible she had also a brachytherapy, so we would be too sure unless we check. What's the duration of vaccination and schedule for testing? Oh, you've answered that question already. Any more questions? Okay, if we don't have any more questions, then can we have the video show on the Evelyn brush, which is the self-sampling kit?
Evelyn brush. Instructions for self-sampling at home. Before you begin, read the instructions for use carefully. Thoroughly wash your hands and lay down the Evelyn brush within reach. Remove the Evelyn brush from the packaging. Do not throw the packaging away, as it is necessary for sending the Evelyn brush to the laboratory after usage. Press the sides of the pink cap to remove the pink cap from the Evelyn brush. Ensure that you do not touch the white brush with your hands. Assume a comfortable position, such as when you insert a tampon. Spread your labia with one hand, and with the other, insert the Evelyn brush into your vagina until the wings touch your labia. Hold the transparent casing with one hand, and with your other hand, push the pink plunger in the direction of the transparent casing. You will hear and feel a click when the brush is in the right position. Turn the pink plunger 5 rotations in the same direction. After each rotation, you will hear a click. After turning the plunger 5 times, carefully remove the Evelyn brush. Hold the transparent casing with one hand, and with your other hand, pull on the pink plunger until the white brush disappears into the casing. When doing so, do not touch the top part of the Evelyn brush above the wings. Hold the transparent end to ensure the white brush does not extend again. Place the pink cap back on the Evelyn brush. You will hear a click when it is properly in place. Put the Evelyn brush back inside the packaging. Place the packaging containing the Evelyn brush into the plastic bag and seal it. Follow the return instructions. Evelyn brush. Instructions for self-sampling at home. Before you begin, read the instructions for use carefully. Thoroughly wash your hands and lay down the Evelyn brush within reach. Remove the Evelyn brush from the packaging. Do not throw the packaging away, as it is necessary for sending the Evelyn brush to the laboratory after usage. Press the sides of the pink cap to remove the pink cap from the Evelyn brush. Ensure that you do not touch the white brush with your hands. Assume a comfortable position, such as when you insert a tampon. Spread your labia with one hand, and with the other, insert the Evelyn brush into your vagina until the wings touch your labia. Hold the transparent casing with one hand, and with your other hand, push the pink plunger in the direction of the transparent casing. You will hear and feel a click when the brush is in the right position. Turn the pink plunger 5 rotations in the same direction. After each rotation, you will hear a click. After turning the plunger 5 times, carefully remove the Evelyn brush. Hold the transparent casing with one hand, and with your other hand, pull on the pink plunger until the white brush disappears into the casing. When doing so, do not touch the top part of the Evelyn brush above the wings. Hold the transparent end to ensure the white brush does not extend again. Place the pink cap back on the Evelyn brush. You will hear a click when it is properly in place. Put the Evelyn brush back inside the packaging. Place the packaging containing the Evelyn brush into the plastic bag and seal it. Follow the return instructions. Evelyn brush. Instructions for self-sampling at home. Before you begin, read the instructions for use carefully. Thoroughly wash your hands and lay down the Evelyn brush within reach. Remove the Evelyn brush from the packaging. Do not throw the packaging away, as it is necessary for sending the Evelyn brush to the laboratory after usage. Press the sides of the pink cap to remove the pink cap from the Evelyn brush. Ensure that you do not touch the white brush with your hands. Assume a comfortable position, such as when you insert a tampon. Spread your labia with one hand, and with the other, insert the Evelyn brush into your vagina until the wings touch your labia. Hold the transparent casing with one hand, and with your other hand, push the pink plunger in the direction of the transparent casing. You will hear and feel a click when the brush is in the right position. Turn the pink plunger 5 rotations in the same direction. After each rotation, you will hear a click. After turning the plunger 5 times, carefully remove the Evelyn brush. Hold the transparent casing with one hand, and with your other hand, pull on the pink plunger until the white brush disappears into the casing. When doing so, do not touch the top part of the Evelyn brush above the wings. Hold the transparent end to ensure the white brush does not extend again. Place the pink cap back on the Evelyn brush. You will hear a click when it is properly in place. Put the Evelyn brush back inside the packaging. Place the packaging containing the Evelyn brush into the plastic bag and seal it. Follow the return instructions.
Thank you very much. Thank you very much. Can somebody please speak to the Evelyn brush and throw more light on it? Is it you are going to do that also far?
All right, I can do that.
Okay, thank you.
So when it comes to HPV testing or even pap smears and things like that, one of the major setbacks has been the issue of privacy. Lots of females start to think about the fact that they have to go in, take off their clothes, be in front of somebody they've probably never met before, and then it's a whole lot of invasion of your privacy, even though it's necessary. And so the Evelyn brush has been developed such that you can take your sample for HPV DNA testing at home. When we went to Inzulezo, that was the same device that we used. We taught them, took them through, they did some demonstrations before they went in, and all of them said it was fine. They had no problems, and they were able to take the samples, and all the samples that were taken were used. None of them were rejected by the lab. So just to speak a little bit more to HPV DNA self-sampling. So this study, it was done in China in 2022, where they had about 20,000 women in the entire study, but about 8,000 of them wanted to do self-sampling. And almost 96% were saying that the self-sampling was easy to do. About 85% had no discomforts. And a little over 60% said they were definitely more willing to choose self-sampling for cervical cancer screening in the future. And also a wide majority said they would introduce it to others around them as well. And then this study was done in Canada. It was published this year, but the study itself was done between 2021 and 2022. There they had a fewer number of women, about 108. and 69 of them did self-sampling, wanted to do self-sampling, but actually only 61 said they found it user-friendly. And most of them said that because of privacy and comfort, the self-sampling was the method they would continue to use. So this speaks to the fact that self-sampling is actually useful. Studies also show that the samples that are taken using this self-sampling device are able to produce results as good as if you went into a facility and a nurse or a doctor or somebody else took the sample for you.
Wow. 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 So can community pharmacists stock the Evelyn brush, and how much is it going for?
Yes, they can stock the Evelyn brushes. I will let Sophia speak to the pricing again.
Okay, so Sophia, please, how much are they going for? Wholesale price or retail price, and how soon can the community pharmacy stock them?
Yeah, I think we'll check and come back to you on the exact pricing of the Evelyn brushes. I think that with the currency exchange fluctuations and the new stock we've gotten in, I just need some time. So I'll get back to you with the pricing.
Any questions? So if there are no questions coming in, how often can you use the Evelyn brush then? Once a year, you know?
So HPV DNA testing.
The pap smear, and how often can you use it?
Yeah,
So for HPV testing.
Sorry, yeah, let me just.
Okay.
Hello, yeah. Sorry. So the expiration, the brushes usually have about a 2-year life shelf life. So they can be used within 2 years.
And how often can you use it? Once a year? How often can you do that?
The brush once, because when you take the sample, you have to send it to the lab. So you can only use it once.
Okay. Once a year?
So the testing is recommended every 5 years for HPV DNA testing. So
Okay.
if you do it this year, you're good for the next 5 years.
Okay. Okay. Any other questions?
I'm seeing Anna is asking about side effects about infertility. Yes. So there have been studies done 2017, 2018, and I think in 2020, where in the USA, they were looking at infertility rates that happened after HPV vaccination. Now, the caveat there was that fertility rates in the US are already declining. And so Global Advisory for Committee on Vaccine Safety and WHO came out to say that there's actually no link between taking the vaccine and infertility. Still no link has been established because in the USA, fertility rates were already down. So it didn't really follow from the study that was done. It would be good for us to also do our own studies here, but currently there's no evidence that backs the claims that were made from those studies.
Okay. And where are the collection points for the kids?
For the Evelyn brushes or
Yes.
for pap smear? So for the Evelyn brushes, sorry, Dr. Kansa, can you come again?
The Evelyn brushes, where would, after you take the sample, where would be the collection points, or where do you send them to?
So it would depend on how you're picking them up. So I know that there's the Sheba kits that Yamachi has. When you pick it up, they have on the back of it the collection points. On our end, if you pick it up from us as well, you would be taking it directly to the specified labs that are recommended for testing.
Okay. Any other questions, please?
Doc A is asking about recommended facilities for pap smears and vaccination. Fortunately, all our major public hospitals do pap smears and vaccination, and most of them do Cervical, that much I'm aware of. I know that Kolebu is still running their promotion on HPV DNA testing, pap smears, and then vaccination with Cervical. So it's good to take advantage of that because the prices are low, I think just from January to February, and then they return back to the actual price. I think currently you can get the vaccine for under 200 cedis, and then the pap smear is around 50 cedis or something like that. So it's good for us to take advantage at this time.
Okay. I think this question has been answered. You spoke to it. Yeah.
Yes, I just did.
And this has also been affordable. I think this has also been answered. She just spoke about this. Yes, yes, the Evelyn brushes are for the HPADN testing. Yeah. Okay, how long can sample be taken with the Evelyn brush before taking it to the lab?
Because it's DNA, usually anything under 14 days is fine, but it's better you send it immediately. We know that DNA is contained in the cell, so it can't really be denatured directly, but under 14 days is recommended. But we are also saying that as soon as you take it, please send it to the lab. So that if you take it and the sample is invalid, you're told early on before you forget about it completely.
The department in Kolebu teaching is the Republic Health Center just behind the Ops and Gynae department. That's where it's been done. Any more questions? Okay, so we've been talking about the role of the pharmacist in beating cervical cancer, which has been the pharmacist CPD, very interesting. And we had Dr. Yao also take us through that, and Madam Mrs. Sophia Ba, also the CEO of M-Pharma, also gave us the opening remarks. There's been very interesting talk, and I hope you've learned a lot from today's presentation. I mean, we had the health awareness month of cervical cancer for January, but I believe that we'll be talking about this all year round. Cancers, which is a non-communicable disease, has to be talked about all year round because we are seeing them now a lot. And I believe that the awareness also must go on. And I believe that LAPAC has a lot to do in collaboration with M-Pharma and has proved so. And I just want to say that cervical cancer is the second most common cancers among females. So we should really identify the symptoms very early, and be it in the community or in the hospital pharmacy, please, as hospital or community pharmacists, male or females, please refer the patients. And when we see them in our loved ones, I mean, for the men online, our wives, our loved ones, our sisters, please encourage them also to go to the hospital. I believe we all have individual responsibilities. We should get screened and vaccinated very early, up to 45 years. Parents should get their children, male and female, vaccinated, as we heard today. Men should encourage the women in their lives to be screened and also vaccinated. I believe that you have a great work to do. I mean, encouraging the women to do that, because sometimes the women get discouraged and don't know what next to do. Avoid high risk sexual behavior. I believe even in our kids and the young ones coming up, let's speak to them, educate them. I believe that the pharmacists, especially LAPAC, has a lot to do with health education, advocacy, going back to the schools, educating the young ones, and also doing a lot of work in that. We have a lot of work to do, and I believe we're going to start doing that soon. We should quit smoking if we smoke cigarettes. We should avoid exposure to HIV, HPV by use of condoms, and also avoid multiple sex partners. We've been talking about all this evening, and I believe that before we end the show, we'll have a LAPAC chairperson give us the closing remarks. Over to you, Lucia.
Hello, please, if you can hear me. Good evening.
We can hear you, Lucia. Yes, we can.
Please, can you hear me?
Yes, Lucia, I can hear you.
Okay, Antiama, thank you so much. So I have been enjoying the conversation about cervical cancer. This is the second year we are doing this, which shows that pharmacists, lady pharmacists, or pharmacists in general, are putting in the work when it comes to actually being able to fight cervical cancer. So we are doing education. We are doing education. We are creating awareness. We are doing counseling. I think we need to take it a step further, bring in the advocacy. Now there are pharmacists who do vaccination, so I'm sure that we'll get involved when it comes to being able to engage patients to get the Evelyn brush. Now that we know that it can be stocked in the pharmacies, and also ensure that we encourage more and more of our patients to be able to get vaccinated. We should do the referrals at the right time, because if we do it right, if we do it early, we will be able to save lives. And then do some research. I know that sometimes in the hospitals in community, we don't do a lot of research to find out how many people are coming in to ask about cervical cancer and what that data would actually mean. But it is something that we can take it up. So awareness education we are doing, but I think it's important that we take it a step further so that we can do some advocacy and some lobbying. I know that NHI covers for some cervical cancer, I think something to do with screening, but not treatment. But I think we can engage to ensure that comprehensively and effectively all of that is actually paid for. It is important because cervical cancer is one of the cancers that we can easily prevent. And it will be painful for us to lose a loved one, a neighbor, a church member, a mother, daughter, a cousin, a sister, or somebody around us, or even a male child or somebody who is close to us having cervical cancer of any sort, or even becoming somebody who carries it and then spreading it. So today we've learned a lot, and I'm sure with this knowledge we'll be able to have an impact on our society, reduce cervical cancer. I'm sure that by the WHO deadline of 2030, we would have a story to tell of the impact that we have made throughout the journey. I'll use this opportunity to thank CES. Thank you so much for this learning platform. We learn every day, and today, even for myself, I have learned a lot. So thank you so much, CES. Thank you so much, M-Pharma, for the support. I'm sure we are not going to end here. Let us keep the conversation going on so that we know what we can do together. Should we have cervical cancer champions? Should we have more posters in the community pharmacies? Should we have a day every other month or every quarter to talk about cervical cancer in our OPDs, in our community pharmacies? We should start talking about it, because that's the only way that people would begin to ask, what is this cervical cancer thing about? And what can we do about it? It's also important that as NAPAG members, we are not found wanting. So please, if you haven't tested, please test yourself. Please get an Evelyn brush as soon as possible and then be able to do it. M-Pharma, I'm also hoping that we'll be able to have some simulation centers, because I saw the video, but I don't know how confident I am, even as a pharmacist, to be able to do a demonstration or even check on myself and ensure that I don't have a test done, which is not going to be the right thing that is supposed to be done. And Siama Opag, thank you so much for your support. It's important that we all know that there are oncology pharmacists. There's an association called Oncology Pharmacy Association of Ghana. They've been supporting us with champions, people who have the knowledge to be able to tell us how to navigate through these very uncertain times when it comes to cancer. We can beat cancer, we can fight it one cancer at a time. Let us take cervical cancer and see what we can do about it. I'm hoping that in future, there's a lot of engagements going on. And then in future, we would add on breast cancer also when it comes to the screening. So it'll be breast and then cervical cancer. And on this one, I also like to thank the coordinator, the project coordinator, Joapeni Yvette. Thank you so much for the good work that you are doing when it comes to all the things you are doing against cancer, cervical cancer, second year in a row, all the education that is going out there. We are very grateful. Please keep the good work going. Dr. Ya, thank you so much for the education. Auntie Felicia, thank you for sharing your story. Auntie Rabna, the pharmacist who actually was able to let us find a survivor who was willing to actually speak about the condition and everything she went through. It is not easy to fight cancer, and usually it's very difficult to do it alone. So we thank God for the pharmacists and the other health practitioners, the doctors, the nurses, oncologists, everybody who supports in ensuring that we have optimal health care for our patients. Let's continue the good work and ensure that we keep it going one patient at a time. Thank you for this platform. Thank you, PSGH. Thank you for everybody. If I've forgotten, it's because there are so many people to thank for a very good education like this. And thank you for all the people who registered. My understanding is that we have over 900 people who registered, and I think over 400 online. Thank you, and please keep the education going. Thank you, and let us fight cervical cancer. Thank you. Long live PSG, long live LAPAC. Thank you. Over.
Thank you, Madam Chair, Madam Lucy Adai, for the good work you're doing. Thank you, Lucy, and your team for the good work. Pharmacists, thank you for joining. Thank you for the over 400 pharmacists who joined. And just know that early detection saves lives. We have a role as pharmacists to play in beating cervical cancer. Please let's go out and do the work and do it well to the glory of God. Thank you all and have a good evening.
Thank you.